Assalamu alaikum everyone. Today we will start new part of the neurology, that's a motor system. Okay. In our previous lesson we provided information about the sensory system, and today we will initiate motor system of the body. Okay. First of all, in these two pictures you can find out some information about the localization of the motor areas. That's a lateral view of the hemispheres, that's a medial view of the hemispheres. In the black color, that is the primary motor cortex. Okay, and I should say that in our previous lessons in the sensory system of the nervous system, we provided information about the postcentralis gyrus that's responsible for sensory system. Okay, and that's the sulcus centralis. The anterior part of the sulcus centralis located primary motor cortex, and its function is generating signals to direct the movement of the body. Okay, I should talk about the bed cells. Bed cells is located in the primary motor cortex, and their main function is generating action potential to stimuli muscles, and as a result the muscles can contract and you can perform and do some kind of actions. Okay, and next area that's responsible for motor system, that's premotor cortex. Premotor cortex locates the anterior part of the primary motor cortex, and that's main function is planning and organizing some kind of movements. And the second main function is regulating the primary motor cortex. Primary motor cortex can be stimulated by premotor cortex. Okay, and the next area is supplemental motor area. Supplemental motor area, according to its name, its function is supplementary, and its main function is planning of the complex movements. You know, some kind of football players, basketball players, or drivers can do and perform some kind of difficult actions, and they can perform it by supplemental motor area. Okay, please look at there. That's the localization of the primary motor cortex in the medial view of the hemispheres, and the supplemental motor area in the medial view of the hemispheres. Next information about the homunculus, motor homunculus. If you learned deeply our sensory homunculus in our previous lessons, it will not be any kind of difficult part of the motor system to learn motor homunculus. Please look at that. And all of the cells that's responsible for action of our body is located there. They are bed cells, and there is a section of this part. That's primary motor cortex. We sectioned it from this side and draw it there. Okay, and look at there. And which part of the hemispheres is responsible for the movement of our body is illustrated there very easily. And we will begin from the toes. Toes are the bed cells that's responsible for moving and some kind of actions, and the motor system of the toes is located there, and that part is there. Okay, and that part is responsible for ankle, knee, hip, trunk, elbow, fingers, and the face. Okay, and I think it's very easy for you to memorize this part of the motor homunculus, and that's further and clinical information for you. That's most important. You know, the hemisphere is supplied by three main arteries. That's anterior cerebral arteries, middle cerebral arteries, and posterior cerebral arteries. For diagnosing the patients who are suffering from some kind of strokes, can be diagnosed according to some kind of clinical picture of the patient. If the patient has some kind of difficulties with the movement of the lower limb, we should talk about the supplemental blood supply of this hemisphere. Okay, blood supply of this part that's responsible for the lower limb movement is supplied by anterior cerebral artery. Okay, without any computer tomography or magnet resonance image, you can diagnose correctly according to the clinical picture of the patient. All of the main and beneficial information is all for you today, and thanks for listening and watching. See you next time.